Hello dear students, very warm welcome to all of you at our conceptual brainstorming integrated session of ENT. So we are going to start our today's ENT session. Please inform me that audio, video, everything is clear, as I will get information from your side. We will immediately start. Just give me the thumbs up. Please give me the thumbs up if everything is okay. Audio, video, everything is okay. Yes. Please comment. Please comment. Yes, good afternoon. Yes, good afternoon, Suraj. Please inform me audio, video, everything is okay, beta. We are going to start our session. Okay. Yes, okay. Thank you, Suraj. Thank you. So we are going to start our session. Hello, everyone. Very warm welcome to all of you at our conceptual brainstorming integrated session of ENT. So in previous session, we had already seen the different test for the Eustachian tube. So in this part, we are going to learn about our Eustachian tube disorder. So make this session interactive. Yes. Hello, beta. So here we are starting our very interactive class for the Eustachian tube disorder. Okay. So any kind of the doubt you can ask. Chat box is also open. Okay. Yes, Eustachian tube disorder. See here, we had already seen the external ear pinna and another part, that is our external auditory meatus. Then you can see the tympanic membrane. Yes, here you can see the middle ear cavity. This middle ear cavity is connected with our auditory tube. You can see here the Eustachian tube, which is connected with the nasopharynx. In anatomy already we had seen that our auditory tube is opening in the lateral wall of the nasopharynx. Okay, so this is the one diagrammatic presentation. This session is especially dedicated for our diseases of the auditory tube. Okay, so try to understand this disorder. Fine, we are going to look for this all the things step by step. We are preparing the notes also from the UG level. Thingrasar textbook, ENT textbook we are referring. Then we will increase, we will level up ourselves. We will go for the NEET PG exams, we will go for the INICET, we will go for the FMGE exams, USMLE, PLAB, all, and we will see the next pattern, clinical integration. So try to understand what is happening normally. Okay sir, auditory tube is closed. Agree? हमने पहले की क्लास में ऑडिटरी ट्यूब की एनाटॉमी देखी थी. यस, इट इज हैविंग द टू एंड, pharyngeal end and tympanic end. Pharyngeal end is normally closed. Okay sir, now try to understand, but it opens intermittently during swallowing. आप swallow कीजिए, you will feel the movement, you will feel that movement in the ear also. आपको sound सुनाई देगा during the swallowing, even during the yawning and sneezing. So to maintain the proper pressure, our auditory tube is opening intermittently. Now try to understand why it is getting open. It is getting open through active contraction of tensor palatini muscle. Yes, we had seen टेंसर पैलेटिनी मसल जो होती है वो ऑडिटरी ट्यूब से जुड़ी हुई होती है. जब ये कॉन्ट्रैक्ट होती है तो ये डायलेटर ट्यूबी मसल की मदद से इसके ओपनिंग को ओपन कर रही थी. फाइन. नाउ ट्राई टू अंडरस्टैंड फर्दर. ड्यू टू दिस ओपनिंग gases are coming from the oral cavity, from the auditory tube into the our middle ear cavity. Okay sir, गैस जो है वो हमारे middle ear cavity में पहुंचा. Gases in auditory tube, they are presenting. What are the different gas? Whatever the gas outside in the environment, oxygen is there, carbon dioxide is there, nitrogen is there, even water vapors are there. Agree sir? Now try to understand among this all, this oxygen is first absorbed while these other are later absorbed. Definitely oxygen की जरूरत है हमको, so oxygen is first absorbed. Agree everyone? Now try to understand further things that due to this all the absorption of gas, due to absorption of gases. Okay sir, what is happening? Negative intra tympanic pressure is formed. Yes, there is a formation of the negative intratympanic pressure because gases are absorbed. Getting the point? Now try to understand the our further points. That see here, this is about our different more facts. Now due to this absorption, what is happening? There is retraction of tympanic membrane. So our tympanic membrane is going inside. Yes, it is balanced by the outside pressure. There is the extracoustic meatus pressure, and inside there is the our middle ear cavity. But middle ear cavity pressure is decreasing, so outside pressure is more, so it will press. So our tympanic membrane is going in this way. It is not flat. It is going our inside. It is getting retraction. Now try to understand further. Due to this retraction of the tympanic membrane, if there is the more rise in negative intra tympanic pressure, getting the point? So if there is the more and more decrease, more and more fall in the intratympanic pressure, or you can say increase in negative intratympanic pressure, what you will see, there will be locking of tube. The auditory tube, it will get locked. Now try to understand due to this all what will happen. Yes, now it is a closed pathway. You know, the inner lining of the our tympanic cavity, it is having the secretory part. So secretion is coming, but there is no ventilation, there is no gas, so there will be the accumulation of the fluid. So you will see there is the presence of, yes, transudate accumulation, and later this transudate, yes, it will convert into the exudate accumulation. Do you remember pathology? Transudate, just transfer of the fluid. So it is very thin water like fluid. But exudate, there is the exit, there is the exit of the protein molecules, inflammatory molecules, pus, inflammatory cells. So this is sterile, but it is inflammatory. So just one pathology integration. Now try to understand this exudate accumulation. Yes, later further if it is blocked, blood may also accumulate. So you will see the hemorrhage in middle ear cavity step by step. Now try to understand the more points. ultimately this situation when there is the closure of this our auditory tube, yes sir, this is the auditory tube, if it is getting blocked, so gas is absorbed here, pressure is decreasing inside it, yes, decrease pressure, so this tympanic membrane is getting more and more retraction, fine, it is going inside, so this all will lead to the beginning of the inflammation, so there will be the, yes, there will be the our exudation, there will be the presence of the, yes, transudate first, exudation, then blood accumulation. So these are the problems, and hemotympanum may also develop. Blood within our tympanic cavity, that is a hemotympanum. Okay, so these are our different points. Okay, you can follow your Dhingra sir textbook. Okay, that is a disorder of the Eustachian tube. We are looking, the first one is our, yes, tubal blockage. This situation is tubal blockage. So here one flow chart is given. You can see here we are taking the proper reference from our standard textbooks. So only one strong reading unit, and what are the different causes of the Eustachian tube block also we are going to include. So you can see, observe, you can observe here, situation is our auditory tube blockage. Yes. So two tables we are including from our standard textbook, Dhingra sir textbook. Can you see one beautiful flow chart? That is effect of the acute and prolonged tubal blockage. So Eustachian tube block, two types, acute and you can say chronic. बिल्कुल सही है, एक acute condition है, एक chronic condition है. Acute condition, same things are here. Acute tubal blockage, correct sir, अचानक block हो गया. Absorption of the middle ear gases, correct, we had seen. Negative pressure in the middle ear cavity, yes, it is leading to the retraction of the tympanic membrane, correct. Now it is leading to the transudation, exudation, and even sometimes acute hemorrhage. Getting the point? So these are the our different situation. In this way it is leading to the acute otitis media. यानी एक चीज समझ में आई कि अगर मान लो acute tubal block हुआ तो आपको acute otitis media मिलेगा, acute otitis media effusion मिलेगा. Yes, we will see the otitis media in our upcoming class. Now see prolonged, अगर लंबे समय से ये बंद है, dysfunction है, so in that situation there is our otitis media with effusion. Okay, you will see the water like discharge, you will see the mucoid discharge, पानी जैसा secretion रहेगा या चिपचिपा secretion रहेगा. It will lead to the collapse of the our tympanic membrane. Yes, atelectatic ear, middle ear cavity के अंदर आपको पता है main content is the air, so air will not be there, it will get collapse. That's why atelectasia, just like the our situation of the emphysema. Fine. Now it will lead to the excessive pressure over the tympanic membrane. Tympanic membrane अंदर की तरफ बहुत जोर से खींचेगी जिसका उसमें छेद होने के चांसेस है. Tympanic membrane perforation you will get. Yes, Then there is the retraction pocket is formed, and we will see in this retraction pocket there is the deposition of the our keratin granules, which can cause cholesteatoma, which is very important chapter. Yes, so ultimately it is leading to the erosion of the incudostapedial joint. It will affect the incudostapedial joint also. So these are the our different points regarding the our blockage. Also another table you can see causes of the Eustachian tube obstruction. So you can see here what are the different our cause. Definitely one is infection either by the virus or bacteria. Other are allergy, sinusitis, nasal polyp. They can also cause obstruction. The midline septa of the nose, if it is deviated, it can cause the blockage of the our auditory tube. That is a deviated nasal septum. Hypertrophic adenoid, there is the aggregation of the lymphatic tissue in the nasopharynx. Do you remember the Waldear's ring? Yes, in anatomy we had seen the adenoids. That is getting hypertrophy. It will block our auditory tube. Also there are the different kind of the tumor, even the cleft palate, Down syndrome, and functional. These are the different causes of the obstruction. Yes, further we are moving for the better marks in our exams. Try to understand this auditory tube obstruction. What are the different causes of this auditory tube obstruction? One by one. Yes, three types. First is mechanical obstruction. Second is functional obstruction. Third is both. Getting the point? So auditory tube, it is getting obstruction, and three types of the causes may be there. What are the different our mechanical cause? Yes, mechanical cause, again you can divide under the two category for your theory preparation. Yes, Q2. First is your intrinsic cause, and one more is your extrinsic cause. Auditory tube, it is getting blockage due to the pathology inside the auditory tube. Another is outside the our auditory tube. Okay, so intrinsic, inside our body, that is due to inflammation, or it may be due to allergy. While the extrinsic causes, try to understand, it can occur due to any tumor, or it can occur due to adenoids. Getting the point? Now try to understand what are the our different functional causes. Yes, we are looking for the different functional causes. See here, it can occur due to collapse. Auditory tube, it is getting collapse. Yes, collapse of the auditory tube. Now see here, it can occur due to failure of our tensor palatini muscle opening mechanism. Yes, we all are aware when the tensor palatini muscle is contracting, it is responsible for the opening of the our auditory tube. Okay, so if this function is not working properly, in that condition auditory tube will not get open. And last is our bone. So this is the one table which you can mention for your university exam. Now come to our next. Yes, this all will lead to the which kind of the clinical features. Yes, we are looking for the our clinical features. क्या क्या सिम्टम्स होंगे जिसमें पता चलेगा कि हाँ भाई इस आदमी का ऑडिटरी ट्यूब ब्लॉक है. सी हियर, पेशेंट विल कंप्लेन अबाउट द ओटेल्जिया. This is our next pattern. Yes, one patient is coming to you with the pain in the ear. Fine, sir. Next, he will say also about the hearing loss. Yes, patient को ठीक से सुनाई नहीं देगा. Also, he will give about the popping sensation. Yes, उसे ऐसा लगेगा जैसे कान कभी बंद हो रहा है, कभी खुल रहा है, कभी बंद हो रहा है, खुल रहा है, अजीब सा एक पॉपिंग सेंसेशन उसे फील होगा. Also, he can complain about the tinnitus and vertigo. So these are the different presentation. Getting the point? Now, okay, but this otalgia, hearing loss, popping sensation, it can appear in any other kind of the disease also. So how you will identify? Try to understand how you will get that this is the case of the Eustachian tube block. For it, you will look for the our different signs. So now we are going to look for the signs. Okay. Yes, you will see in otoscopic examination there will be retracted tympanic membrane. Tympanic membrane अंदर की तरफ धसी रहेगी. And another you will see there is the congested tympanic membrane. So these are your different findings. Okay, now try to understand our more points. These are our different things about the auditory tube blockage. Yes, now we are going to look for the our next situation. See here, जब आप अपने टेक्स्ट बुक को फॉलो करेंगे. Okay sir, so you are getting this all the theory part we made easy, and sometimes excessively you will see the hemotympanum. Yes, you can add. There will be the red hyperemic congested edematous swollen appearance. Yes, you can get there is accumulation of the blood. So situation of the hemotympanum. Hemo means blood, tympanum means middle ear cavity. Okay, and sometimes you can find the perforation also. So these are the our different cause. According to the cause of the disease we have to treat. Okay, next in your textbook the next situation which is given, that is your adenoids causing Eustachian tube impairment. First was our Eustachian tube block. Now we are going to talk about our adenoid causing the Eustachian tube impairment. So try to understand. Recall our first MBBS Waldear's ring we had seen. Yes, around the our nose, mouth. When you were observing inside, yes, there was the tongue. So we had seen there are the location of different kind of the lymphatic aggregation. हमारे नेजोफेरिंग्स, पैलेट और टंग के चारों ओर रिंग फॉर्म में एक्यूमुलेशन था. इसका yes, that was our aggregation of the lymphoid tissue. So we are showing that aggregation of the lymphoid tissue at the nose region, near the auditory tube, near our palate, and at the tongue. So this was our Waldear's ring. Yes sir, this was our Waldear's ring. Nasal, or better to say nasopharyngeal. Tonsil, yes, here was the auditory tube opening, that's why this was known as the tubal tonsil. Yes, here was the our palatine tonsil, and here was, yes, that was the lingual tonsil is all we are known as Waldeer's ring. Correct. This is the very important question. Now try to understand, if there is the excessive proliferation of this nasopharyngeal tonsil, then it is known as our adenoid. Okay, sometimes tubal tonsil, they are also getting proliferation and they are causing the blockage of the auditory tube. ये auditory tube को block कर देते हैं. Okay, so what you can remember that these adenoids, अलग से हम पूरा discussion करेंगे, इसके ऊपर एक chapter है. Yes, remember adenoids, they are responsible for the auditory tube opening block. Now see here, this our adenoid is, yes, it is the cause for the auditory tube block. Also it is reservoir for bacteria or virus. Adenoid is the place, it is the lymphatic aggregation site, which is the site for the our bacteria and the virus. Okay, now try to understand third point also, due to allergy. From here, the mast cells which are located, they will cause release of the inflammatory chemical mediators. Getting the point? So this all will lead to the acute otitis media. Okay, now try to understand, this is treated by, how you will treat, because it is due to the adenoid, so you will perform the adenoidectomy operation. Yes, this is a simple treatment. In case of the tubal block, whatever the cause of the blockage, you have to treat that one. This tubal block is due to the, yes, adenoid, you have to remove the adenoid. Now further, next cause we are going to look after this adenoid, that is simply cleft palate causing auditory tube impairment. So this is the point which you can remember. Yes, see here, this cleft palate, yes sir, it is causing otitis media with effusion. It is leading to the otitis media and there is the accumulation of the effusion. Definitely cleft palate, there is a partition in our palate, the oral cavity and the nasal cavity, they are communicating. On the lateral wall of the nasal cavity, we all know there is a presence of the auditory tube. So this auditory tube is getting abnormal functioning. So there is the sometimes hypertrophy of the tissue in the oral cavity. To compensate this cleft palate, it will lead to the auditory tube blockage, and whenever there is the auditory tube blockage, there is the otitis media with effusion. Okay, now try to understand, in this situation auditory tube function becomes abnormal directly, also sometimes indirectly. Now see here, next situation which affects the auditory tube function we are going to talk, that is Down syndrome. Getting the point? So we are going to look for this our Down syndrome. Yes, in case of the Down syndrome, there is the different kind of the congenital abnormalities, among which one is your poor tone of the tensor palatini muscle. Okay sir, various congenital symptoms are there. One of them, tone is poor, tensor palatini muscle is getting affected, and tensor palatini is responsible for the opening of the auditory tube. So auditory tube is not getting open. So what is happening? Try to understand. Auditory tube is function which is leading to the again acute otitis media. Fine. Now try to understand the next situation which is given in your textbook, that is barotrauma. Yes, due to the excessive atmospheric pressure, due to any cause, either maybe due to the blast or due to the nature, okay, it can cause the difference in the pressure outside and the inside, so it can cause the trauma to the our auditory tube. Next we are going to look for the our more points. Yes, that is retraction pockets and Eustachian tube. So one more topic is given, retraction pockets. Small cavities, small pockets are developing within the our medullary cavity due to the retraction of the tympanic membrane. So we are going to look for this point. You will see normally there is the our air flow, air pathway. How the air is flowing in the auditory tube, try to understand. Yes, outside it is going to the our nasopharynx, oral cavity, from where the air is reaching into the auditory tube, Eustachian tube. From here the air is reaching into the middle ear cavity. Yes sir. And we know in the middle ear cavity, epitympanum, mesotympanum, these are, so mainly the air is reaching into the mesotympanum, middle ear cavity. Fine. Now try to understand from the mesotympanum. We all are aware that there is our auditory tube and then middle ear cavity, and then there is a edictus and antrum. One simple diagrammatic presentation of the middle ear cavity relation. Okay, so here was the our mastoid air cells. Yes, which is having one opening here. This is our middle ear cavity, one diagrammatic presentation. It is having the gun like appearance. So you all are aware that it is our auditory tube. Here is middle ear cavity. This opening between the middle ear cavity and this is our mastoid antrum. Yes, this opening is known as edictus. So the air is coming from outside, reaching into the auditory tube and making aeration of the middle ear cavity. Then air enters through the edictus into the our, yes, mastoid antrum. So this is the pathway of the air, and proper ventilation in the middle ear cavity is there. So normally there is no accumulation of the fluid. Okay, so you will see that through the mesotympanum it will reach to atic area, then to edictus, and then antrum of mastoid cavity. Getting the point? So in this way there is the proper our flow of the air. Okay sir. This is the thing which you have to remember. Okay, now try to understand if there is obstruction in this pathway. Yes, then it will result, correct, in formation of the retraction pockets. Yes, it can also lead to a atelectasis of tympanic membrane. So it can cause the atelectasis of the tympanic membrane also. Okay, so these are the different cause. So what are the different reason for this all? See here in your textbook, you will see different cause list including from the टेक्स्ट बुक। ऐसे कौन कौन से कारण हैं जिनमें हमारा ये जो एरेशन का पाथवे है ये ब्लॉक हो जाते हैं। तो यू विल ऑब्जर्व द लिस्ट फ्रॉम योर टेक्स्ट बुक। So try to catch this, apply the anatomy knowledge, you will see that there is obstruction of the Eustachian tube. Agree sir? It will cause total atelectasis of the tympanic membrane। अगर Eustachian tube ब्लॉक हुआ तो प्रेशर यहां मेंटेन नहीं हो पाया और हमारा जो टिम्पेनिक मेम्ब्रेन है टोटल का टोटल यस कोलैप्स हो गया। फाइन। Obstruction in the middle ear, if there is a blockage in the middle ear, so small due to the yes increase in negative intratympanic pressure, retraction pocket will be formed। Fine, getting the point? And within our middle ear there are the two, our isthmus, anterior isthmus and posterior isthmus। Remember, retraction pocket is formed in this situation in posterior part, while the anterior part it is ventilated due to the our yes remember auditory tube is proper, तो ऑडिटरी ट्यूब इट इज ओपनिंग इन द एंट्री पार्ट, तो यहां पर प्रॉपर एयर पहुंचता रहेगा, लेकिन पीछे वाले पार्ट जो है वो ब्लॉक है। ऑब्स्ट्रक्शन ऑफ द isthmi, देयर आर द टू isthmi, एंट्री isthmus एंड द posterior isthmus। So if this isthmi are getting blocked, atic portion is showing the small pouch retraction pocket। Obstruction of the editors of the our mastoid, go for the anatomy then you will understand this all the term। Okay, so editors is the opening in our mastoid antrum। If there is an obstruction in that situation, you will observe there is our cholesterol granuloma, you will see in the topic of the cholestatoma। Okay, so it will lead to the collection of the mucoid discharge, यहाँ पर चिपचिपा सा secretion जमा हो जाएगा। Okay, so this will cause accumulation within our mastoid air cavity, while the middle ear and atic portion will be normal। Okay sir, fine, just one knowledge। Now try to understand due to this all what the different signs will be presented। Okay, so patient will present with the thin atrophic tympanic membrane 1। Okay sir, due to this all retraction pockets, due to this all abnormality, the tympanic membrane is getting atrophied, ये छोटा हो जा रहा है, yes shrunken हो जा रहा है। Also you will see there is the our partial or total cholestatoma, we will see this cholestatoma topic। Okay, it is created, retraction pocket बनते हैं तो cholestatoma का formation होता है। Next you will see the bones are not proper, bones जो भी हैं वो भी सड़ने लग जाती है। yes you will get ossicular necrosis। also you will see there is the establishment of the ventilation। okay, now try to understand due to this all sclerosis may occur, यहां पर आपको फाइब्रोसिस नजर आ सकता है। you will see the tympanosclerotic changes, these are seen। so these are the our different signs that are visible। getting the point? आगे बढ़ते हैं। yes, try to understand further how you will treat। so whatever the cause of the disease, yes you have to remove them, whatever the cause of the disease you have to remove them, treat the underlying cause। so remember we have to first repair of irreversible pathological process। okay sir, whatever the disease is on the progress we have to stop it। now further what you have to remember, there is the our again establishment of वेंटिलेशन, क्योंकि ब्लॉक हो गया है, एयर नहीं आ रहा है, इस वेंटिलेशन प्रॉब्लम के कारण आप वहां पर रिट्रैक्शन पॉकेट देख रहे हैं। तो एक काम कीजिए, due to the different surgical process you can make the establishment of the ventilation. So this will be the treatment portion. Now we are going to look for the last situation, that is our patulous Eustachian tube. Patulous means विस्तृत, बड़ा, फैला हुआ. If Eustachian tube is more and more in size, then what you will do? So making the notes, see here, due to different kind of the unknown cause, okay sir, or due to rapid weight loss, fine sir, yes, you will see this rapid weight loss in case of the pregnancy also. So this situation can occur after the pregnancy, in the pregnancy. Also one more situation, that is the multiple sclerosis. This multiple sclerosis is also related with the patulous Eustachian tube. Okay, what you have to remember, this all will lead to abnormal पेटेंट यूस्टेकियन ट्यूब. यूस्टेकियन ट्यूब जो है वो खुला का खुला रह गया, फैल गया. ओके, so what the different symptoms will occur? So we are looking for the different our symptoms. Yes, try to understand. There is our autophony. Yes, it is autophony. अगर यूस्टेकियन ट्यूब खुला रह गया तो अब क्या होगा, आदमी के मुंह में जो भी आवाज होगी वो कान में सुनाई देगी. बड़ी फनी सी सिचुएशन है, दैट इज अ ऑटोफोनी. यस, द पेशेंट इज हियरिंग वेरी वेरी लो फ्रीक्वेंसी साउंड ऑल्सो. फाइन, ट्राई टू अंडरस्टैंड. वन एग्जाम्पल लाइक ओन ब्रीथ साउंड. आदमी जो है वो खुद की सांसों की आवाज सुनने लग जाता है और इस कारण उसको खूब प्रॉब्लम होती है. ओके, नाउ ट्राई टू अंडरस्टैंड इन दिस सिचुएशन व्हाट आर द डिफरेंट साइंस. यस, यू विल सी देयर इज मूवमेंट ऑफ tympanic membrane with inspiration and expiration. Simple, very simple. that आप खुद लॉजिक लगाइए, कोई आदमी खुद की सांसों की आवाज सुन रहा है, ये तभी पॉसिबल है जब हमारा ऑडिटरी ट्यूब ओपन है, तो ब्रीदिंग साउंड्स आर हर्ड. So you will see the pressure changes directly going to the our tympanic membrane. So with the inspiration and expiration, there is the movement of the tympanic membrane. Okay, now try to understand our further more things. What the treatment you will apply? Yes, treatment for the acute disease. Remember, generally these are self limiting, so no treatment. Okay sir, this disease patulous Eustachian tube, if suddenly it is occurring due to any kind of the problem, it is automatically corrected. Okay, fine. But if it is chronic, then whatever the cause, just you have to do reversal. कुछ डिसीज वेट लॉस के कारण हो रहे थे, so you have to do the weight gain in the patient. Common sense. Yes, you have to give the potassium iodide oral. It has given the benefit in this disease. Also you can do the cauterization of auditory tube. Okay sir, also you can do the grommet insertion. We will see this grommet insertion एक छोटा सा ग्रोमेटम लगा देते हैं, एक खिड़की की तरह स्ट्रक्चर होती है जो वेंटिलेशन करवाती है, एंड ड्यू टू द प्रॉपर वेंटिलेशन इट इज करेक्टेड. गेटिंग द पॉइंट? नाउ आफ्टर दिस टॉपिक one more thing, that is our auditory tube examination. Yes, already we had seen this point, examination of Eustachian tube, in our previous part. Okay, but even in Dhingra sir textbook it is given, so we are following the same. So open your Dhingra sir textbook in front and follow our classes properly. Okay, you will get very easy. और एक बार पढ़ने की जरूरत है, एक बार नोट्स बनाने की जरूरत है, इसके बाद बुक नहीं पढ़ना, आपको सिर्फ अपने नोट्स को रिवाइज करना है, and take the help of the our e-notes. It will be very beneficial. So we are doing the examination of the our Eustachian tube. Yes, we have to do examination of the pharyngeal end, we have to do examination of the tympanic end. So try to understand this pharyngeal end. Yes, pharyngeal end which is near the pharynx. How we will do examination? We will do by posterior rhinoscopy. Okay, हम नाक को देखेंगे, नाक के पीछे पार्ट को देखेंगे, इसके लिए एक इंस्ट्रूमेंट है पोस्टीरियर राइनोस्कोपी, एंड पोस्टीरियर पार्ट ऑफ द नोज देयर इज द ओपनिंग ऑफ द ऑडिटरी ट्यूब, दैट्स व्हाई. नेक्स्ट यू कैन डू द rigid nasal endoscope. Yes, endoscopy, just to visualize the our nasal portion, special endoscope is there. Also nowadays the flexible nasofaryngoscope is available. Now we are looking the our tympanic end portion, so try to understand tympanic end by microscope. Yes, also with the help of the endoscope, auditory tube visualization with the microscope endoscope through the ear. Okay, also you will use the otoscope. Correct sir? Now try to understand, this all will help to see the retraction pockets and movement of tympanic membrane. Getting the point? Yes, these are seen. Now see here, what are the our other test? What the other test you can do? We had seen in our Eustachian tube test video portion, we will perform the Valsalva maneuver. Yes, we have to close the nose, we have to close the mouth, and then blow. So you will hear the sound in the ear, tympanic membrane will be there. Okay, tympanic membrane movement you can feel. Also we did our polygenition test with the help of our bag. Also we did the toy and pee test. So these are the different tests. Yes, what investigation you have to perform, that is the our, we had already seen endoscopy. You can perform the different allergy test for the inflammation, you can perform the CT, you can perform the MRI. So these are the different tests to see the retraction pocket, our Eustachian tube blockage. Okay, yes, with the help of the CT and MRI you will see the cranial cavity, our petrous part of temporal bone. Okay, if there is a problem in any bony part of the medullary cavity. These are our different points. Just one image for all of you to make easier our endoscopic view, image based session from your textbook, Dhingra sir textbook. See here, this is our image. It is endoscopic view. Okay sir, it is endoscopic view of the what? Nasopharynx. You are inserting the endoscope through the our, yes, oral cavity. Also you can go with our nose. So you are going inside through the nose and watch the nasopharynx region. Yes, it is the nasopharynx, so you have to go from the nose, not from the oral side. Okay, and here you will see one elevation at the site of the opening of the auditory tube, that is our torus tubarius. Yes, we know this torus tubarius is the elevation at the site of the opening of the auditory tube. It is seen in right lateral wall of the nasopharynx, and also the fossa of the Rosenmuller, which is just behind. There is one space just behind the our torus tubarius, just behind the opening of the auditory tube, that is a fossa of the Rosenmuller. This fossa of Rosenmuller we will study later. It is very important question. It is the most common site for the, yes, most common site for the our CA nasopharynx. So when you are observing through the our nasopharynx, can you see this is our auditory tube opening, and there is the our elevation portion, that is the torus tubarius, and one fossa is located behind to it, that is a fossa of Rosenmuller. This is showing the our nasal septa part. Okay, this is the just one simple image based session. We will see more this all the points when we will go for the our nasopharynx part. So this is all about our Eustachian tube diseases. So thank you very much. God bless you all. Remember always, मुश्किलें इंसान को चलना सिखाती है, सपनों का पर्दा निगाहों से हटाती है, गिर गया गिरकर संभल है आदमी, ठोकरें इंसान को चलना सिखाती है, चलना सिखाती है. So whatever the doubt, you can ask at the comment box, you can ask directly us, and go for the description at our YouTube channel. All the social media links are given. You can contact us. Thank you very much. God bless you all. Now starting our live doubt discussion session. Thank you. Yes, any doubt, beta, please ask. Yes, yes, any doubt, beta? So can we end the session? Okay, thank you very much. God bless you all. Ending the session.